Dr. Furkan Shanation. I'm one of the EM attendings at Inova Fairfax Hospital. I'm going to give you guys a quick intro into how to use the Sonosite machine in the ED. There's a ton of things you can do with this machine, but we are going to be very basic today, just learning how to look for fluid that shouldn't be there, foreign bodies that shouldn't be there, etc. So this is pretty much the machine that you'll find in almost every ED. It's the brand Sonosite. First thing you need to do, on-off switch, power button is usually upper left side. Once it loads up, you'll know which probe is engaged at the moment. This is the probe that you can use to look at the heart, the abdomen, basically anything that's not superficial. For more superficial things like veins and superficial foreign bodies, you would use this linear probe. So to properly connect whichever probe you're interested in using, you just have to press the correct button. Okay, so now that I have this probe engaged, just want to show you a few other features. If I want to change the depth of what I'm looking at, there are these depth buttons. As you can see, right now it's set at 16 centimeters. If you want to go further down, you just press the down depth and that will give you a deeper look inside, and the reverse is true if you want to get more superficial. And then once you find the structure that you're looking for, you can even further enhance it by zooming, which will just magnify the image that you're looking at. So once you decide what kind of exam you're going to do, you go to the exam button and you'll see that there's several options: abdomen, OB, cardiac. If you're looking at a pregnant woman and you want to see if there's fetal movement, make sure everything looks good, you just click on the OB one and then you go from there. Same thing for cardiac. If you want to specifically look for a pericardial effusion, or if you want to look for right ventricular collapse in tamponade, go to the cardiac setting. Most often we keep it on the abdominal setting. It's very helpful, especially in trauma situations. We do our fast exams using this abdominal setting. And we are going to look at Martha's foot here, just so I can give you an idea of what bone looks like, what tissue looks like, etc. So basic things you need to know. You don't need to memorize a lot. You just need to know bone will appear white, tissue will appear gray, and fluid will appear black. So everything else is some variation of those three colors and densities. So when you're using the probe, you always want to line up. There's always a little ridge on one side of it. That should be lined up with the blue dot on the screen so that you know your orientation is correct. Okay. So a little bit of goop on the probe. Okay. And I'm going to change the depth a little bit. Okay, so you can see white here is bone. Hold on one sec. So you can see her bones up here. If somebody accidentally got a foreign body, you would look to see if it's protruding through the bone versus if it's just superficial in the tissue here. Okay, and then when you go more medial, you're seeing mostly just tissue here and fluid. Okay. So now we're going to switch over, still going to use this linear probe, and I am going to look for a vein as if I were trying to do an ultrasound guided IV. I'm going to put some lube on the probe. Of course, you will sterilize everything, and there's actually sterile lube that you can use to be even that much more safe when you do it. Okay, so then we see lots of these circles. Those are blood vessels. You can see one here, you can see one here. So the black inside indicates that it's fluid. The gray basically is, the tissue of the vessel. If you want to know whether it's an artery or a vein, you simply push down. If it compresses like this one did, that's a vein. If it pulsates like this one, then that's an artery. So you do not want to poke into that one. So these veins right here are pretty superficial, so typically a nurse is not going to ask you for help finding these, such as this one, but usually we'll be looking a little bit more deeper in the bicep area for some of those larger, deeper veins. Down here is an artery, but next to it should be a vein. Oops, sorry, it's sliding around. Sometimes they're right on top of each other as well. Okay, so fluid, black, tissue, gray, bone, white, as we demonstrated earlier. Okay, so in summary, we learned the basics of the ultrasound machine in the ED. You don't have to be an ultrasound expert. You don't have to have done a fellowship to be able to make some very important diagnoses using just the basics. That black is fluid, gray is tissue, white is bone. If you see things where they shouldn't be, then you know that there's something not right. Again, we learned the power button up here, the depth to look deeper or more superficial, how to change the exam type, cardiac, OB, abdominal. We learned the difference between using this linear probe, which is more useful for identifying vascular structures, I'll say superficial vascular structures, and superficial foreign bodies, and then the other probe for looking at the solid organs, looking at the aorta. Thank you for your attention today. This again was a very simplified introduction. There will be more lessons in the upcoming month giving you far more detail and some more complicated uses of the ultrasound machine. Thank you.